Welcome to another video of Clinical Biochemistry Unit 5. First video. Let's start. 1. Sugar, glucose estimation, God-Pod method. Principle. Glucose is oxidized by glucose oxidase, God, to form gluconic acid and hydrogen peroxide. The hydrogen peroxide reacts with phenol and 4-amino antipyrin in the presence of peroxidase, POD, to form a colored complex, which is measured spectrophotometrically. Procedure. 1. Prepare blank, standard, and test samples. 2. Add reagent containing God-Pod enzyme. 3. Incubate at 37 degrees Celsius for 10 minutes. 4. Measure absorbance at 505 nm. Precautions. Use fresh serum or plasma. Avoid hemolysis. Follow proper incubation time and temperature. Calibration of graph. Use glucose standard, 100 mg/dl. Plot absorbance versus concentration. Normal values. Fasting, 70 to 110 mg/dl. Postprandial, 140 mg/dl. 2. Urea, Berthelot or urease method. Principle. Urea is hydrolyzed by urease to form ammonia and carbon dioxide. Ammonia reacts with phenol and hypochlorite in alkaline conditions to form indophenol, a blue-colored compound measured spectrophotometrically. Procedure. 1. Mix serum with urease reagent. 2. Incubate at 37 degrees Celsius for 10 minutes. 3. Add phenol and sodium hypochlorite. 4. Read absorbance at 570 nm. Precautions. Avoid contamination with ammonia. Use fresh reagents. Calibration of graph. Use a standard urea solution, 40 mg/dl. Plot absorbance versus concentration. Normal values. 10 to 50 mg/dl. 3. Amylase, CNPG3 or starch iodine method. Principle. Amylase hydrolyzes starch into maltose. The disappearance of starch is measured using iodine, color intensity reduces, or by CNPG3 method, yellow color formation. Procedure. 1. Mix sample with starch solution. 2. Incubate at 37 degrees Celsius for 5 minutes. 3. Add iodine and measure absorbance at 660 nm. Precautions. Maintain exact incubation time. Avoid contamination with other enzymes. Calibration of graph. Use known amylase standards. Plot absorbance versus activity. Normal values. 30 to 110 U/L. 4. GPT, ALT, alanine aminotransferase, and 5. GOT, AST, aspartate aminotransferase. Principle. These enzymes transfer amino groups between amino acids and keto acids. The reaction forms pyruvate, GPT, or oxalostate, GOT, which react with 2,4-DNPH to form a colored complex measured at 505 nm. Procedure. 1. Mix serum with substrate. 2. Incubate at 37 degrees Celsius for 30 minutes. 3. Add 2,4-DNPH reagent. 4. Read absorbance at 505 nm. Precautions. Avoid hemolysis. Use fresh serum. Calibration of graph. Use enzyme activity standards. Plot absorbance versus enzyme activity. Normal values. GPT, ALT 7 to 56 U/L. GOT, AST 10 to 40 U/L. 6. Acid phosphatase, ACP. Principle. ACP hydrolyzes phosphoric esters to form inorganic phosphate and an alcohol. The reaction is detected using PNPP, p-nitrophenyl phosphate, forming a yellow compound. Procedure. 1. Mix serum with PNPP substrate. 2. Incubate at 37 degrees Celsius for 30 minutes. 3. Stop the reaction with NaOH. 4. Read absorbance at 405 nm. Precautions. Maintain acidic pH. Avoid hemolysis. Calibration of graph. Use ACP standards. Plot absorbance versus enzyme activity. Normal values. 0 to 6.5 U/L, men. 0 to 5.5 U/L, women. 7 Alkaline phosphatase, ALP. Principle. ALP hydrolyzes p-nitrophenyl phosphate, PNPP, in an alkaline medium, producing p-nitrophenol, which is yellow and measured at 405 nm. Procedure. 1. Mix serum with PNPP substrate. 2. Incubate at 37 degrees Celsius for 10 minutes. 3. Stop reaction with NaOH. 4. Read absorbance at 405 nm. Precautions. Maintain pH greater than 9. Avoid hemolysis. Calibration of graph. Use ALP standards. Plot absorbance versus enzyme activity. Normal values. 30 to 120 U/L. 8 Calcium, OCPC or arsenase-O3 method. Principle. Calcium reacts with ocresolphthalene complexone, OCPC, or arsenase-O3, forming a purple complex measured at 570 nm. Procedure. 1. Mix serum with OCPC reagent. 2. Incubate for 5 minutes at room temperature. 3. Read absorbance at 570 nm. Precautions. Avoid hemolysis. Use plastic tubes, Ca superscript 2 binds to glass. Calibration of graph. Use calcium standards, 10 mg/dl. Plot absorbance versus concentration. Normal values. 8.5 to 10.5 mg/dl. MCQs of above topic. 1. Which of the following best describes the role of peroxidase in the glucose estimation using the God-POD method? A. Converts glucose to gluconic acid. B. Forms a colored complex with 4-amino antipyrin. C. Oxidizes glucose to hydrogen peroxide. D. Hydrolyzes glucose to fructose. Answer: B. 2. In the Berthelot reaction for urea estimation, which of the following compounds is responsible for the blue coloration? A. Indophenol. B. Quinonamine. C. Gluconic acid. D. Nitroprusside. Answer: A. 3. Which enzyme is used in the CNPG3 method for amylase estimation? A. Urease. B. Peroxidase. C. Alpha amylase. D. Phosphatase. Answer: C. 4. During ALT, GPT, estimation, which keto acid is produced as a result of the enzymatic reaction? A. Pyruvate. B. Oxalostate. C. Alpha-ketoglutarate. D. Acetoacetate. Answer: A. 5. What is the optimal pH required for alkaline phosphatase, ALP, activity? A. 3.0. B. 7.4. C. 9.5. D. 11.0. Answer: C. 9.5. 6. In the GOT, AST, estimation method, which substrate does the enzyme act upon? A. L-alanine. B. L-aspartate. C. L-glutamate. D. L-arginine. Answer: B. 7. Acid phosphatase, ACP, is most active at which pH? A. 3 to 5. B. 6 to 7. C. 8 to 9. D. 10 to 11. Answer: A. 3 to 5. 8. Which of the following chemicals is used to stop the reaction in the ALP estimation method? A. Hydrochloric acid. B. Sodium hydroxide. C. Trichloroacetic acid. D. Phosphoric acid. Answer: B. 9. Which of the following factors does not affect glucose estimation by the God-POD method? A. Hemolysis. B. Temperature. C. Ammonia contamination. D. Oxygen availability. Answer: C. 10. What is the wavelength used to measure calcium concentration using the OCPC method? A. 405 nm. B. 570 nm. C. 660 nm. D. 750 nm. Answer, B. 11. The GOT-AST enzyme transfers an amino group from aspartate to which of the following compounds? A. Oxalostate. B. Alpha-ketoglutarate. C. Pyruvate. D. Acetyl-CoA. Answer, B. 12. In the urea estimation method, which of the following substances interferes with the Berthelot reaction? A. Creatinine. B. Bilirubin. C. Ammonia. D. Albumin. Answer, C. 13. The enzyme responsible for catalyzing the hydrolysis of starch in the amylase assay is classified as which type? A. Hydrolase. B. Oxidoreductase. C. Transferase. D. Lyase. Answer, A. 14. In the ACP assay, which of the following chemicals is used as a substrate? A. 4-nitrophenylphosphate, PNPP. B. Glucose 6-phosphate. C. Sodium phosphate. D. Creatine phosphate. Answer, A. 15. What is the main purpose of using phenol in the urea estimation method? A. Reduces ammonia. B. Acts as a chromogen. C. Inhibits enzyme activity. D. Oxidizes urea. Answer, B. 16. In the colorimetric glucose estimation method, which reagent is responsible for the final color development? A. Peroxidase. B. Quinonimine. C. Nitroprusside. D. Orthotoluidine. Answer, B. 17. In calcium estimation, what is the role of arsenazo-3? A. It precipitates calcium. B. It forms a colored complex with calcium. C. It oxidizes calcium. D. It hydrolyzes calcium salts. Answer, B. 18. Which type of reaction occurs in the ALP estimation method? A. Oxidation. B. Hydrolysis. C. Reduction. D. Transamination. Answer, B. 19. Which of the following compounds is formed in the GOT-AST reaction and reacts with DNPH to give a color? A. Pyruvate. B. Alpha-ketoglutarate. C. Oxalostate. D. Acetyl-CoA. Answer, C. 20. What is the normal reference range for blood calcium levels in adults? A. 3 to 5 mg/dl. B. 8.5 to 10.5 mg/dl. C. 12 to 15 mg/dl. D. 20 to 25 mg/dl. Answer, B. Thanks for watching the video.